Hello everyone and welcome to QuickMed, where medicine is explained quickly and easily. This video is going to be a rapid review of antibiotics, so this is great for anybody who would like a refresher or a brief summary on antibiotics and is already somewhat familiar with this information. If you would like some more detailed information, please check out our other videos. When discussing antibiotics, here are some questions that you should ask yourself and questions that we will also answer in this video. When it comes to gram-positive coverage, we need to determine if our antibiotic will cover for MRSA as well as Enterococcus. With gram-negative organisms, we really want to know if we can cover for Pseudomonas as well as ESBL-producing organisms. And then we also have our atypicals, which includes Mycoplasma, Chlamydia, and Legionella. Let's start with our penicillins. Some general rules to keep in mind is that there is no MRSA coverage here, no atypical coverage, and there's generally increasing gram-negative coverage with later generations or classes. Penicillin, our most basic penicillin, covers strep and syphilis, so we really use this mainly for group A strep as well as syphilis treatment. There is increasing staph resistance, so penicillin is not going to be used for MSSA infections. Penicillin does cover some anaerobes, but this is mainly limited to your oral anaerobes. Next, we have Nafcillin, which is the drug of choice for MSSA infections. It also has some activity against strep. For Ampicillin and amoxicillin, the key thing to keep in mind here is that these are the drugs of choice for enterococcal infections. They do have some gram-negative coverage, but it's pretty limited. Now, if you take these antibiotics and combine them with a beta-lactamase inhibitor, you get much better coverage, particularly against some common beta-lactamase-producing organisms. This includes staph, or MSSA, some gram-negatives like H. influenza and Moraxella, and virtually all anaerobes. This is the reason why we can use these antibiotics in particular for a wide variety of issues ranging from sinusitis to respiratory infections to skin and soft tissue infections. Just keep in mind here that pip/tazo is the only antibiotic from this class that covers for Pseudomonas. Now we'll move on to our cephalosporins, and just keep in mind here that these antibiotics do not cover against lame organisms, which is an acronym that stands for Listeria, your atypicals, MRSA, and Enterococci. And just as with our penicillins, we do get better gram-negative coverage here with later generations. For our first generation cephalosporins, which include cefazolin and cephalexin, here you have excellent gram-positive coverage against MSSA and strep. There's very minor gram-negative coverage. Cefazolin here is oftentimes used for prophylaxis during surgery, and we can also use these antibiotics for mild to moderate cases of cellulitis when we're not suspecting MRSA. With our second generation antibiotics, we get better gram-negative coverage, including coverage against H. influenza and Moraxella, as well as coverage against some anaerobes. So we can expand clinical use here to include some upper and lower tract respiratory infections, as well as UTIs and gynecologic infections. Our third generation antibiotics include ceftriaxone, which has good gram-positive coverage, but excellent gram-negative coverage against organisms like E. coli, Proteus, Klebsiella, H. influenza, but not Pseudomonas and no anaerobes as well. Ceftazidime is another third-generation cephalosporin, but this only covers for gram-negatives, including Pseudomonas. It has virtually no gram-positive or anaerobic coverage. Cefapime is our fourth-generation cephalosporin, and this has really good coverage overall. It has broad gram-positive coverage against MSSA and strep, as well as gram-negative coverage, including Pseudomonas. However, it does have weak anaerobic coverage. You can think of cefapime as a step up from ceftazidime because it does have better coverage overall. Our fifth generation cephalosporin, ceftaroline, is the only one that has coverage against MRSA. It also has similar gram-negative coverage as ceftriaxone, which is our third generation cephalosporin, because both of these do not cover for Pseudomonas. Let's now move on to our carbapenems, which are our heavy hitters because these are your broadest spectrum antibiotics. They cover gram-positives, gram-negatives including Pseudomonas, as well as ESBL-producing organisms and anaerobes. The main thing to keep in mind here is that all of the carbapenems cover against Pseudomonas except for ertapenem, so think of E and ertapenem as the exception. As you can imagine, carbapenems are used for many serious infections ranging from hospital or healthcare-associated pneumonia to meningitis to intra-abdominal infections. Alright, so far we've covered our penicillins, cephalosporins, and carbapenems, which includes a majority of our beta-lactam antibiotics. Let's run through a practice case before we end this video to solidify your understanding. In part 2 of this series, we will cover the remaining antibiotics and run through a few more cases to cover the key points you need to know about these antibiotics. Let's say we have a 45-year-old female who is admitted to the hospital because of sepsis secondary to a UTI caused by E. coli. Sensitivities are still pending here. Which antibiotic would you start first? The antibiotic to choose here is IV ceftriaxone, so let's go through why this is the case. So we know the patient is pretty sick and has a UTI caused by E. coli, which is a gram-negative organism, so we need to pick an antibiotic that has good gram-negative coverage overall. So our cephalosporins here would be a better choice than our penicillins because they do offer better gram-negative coverage. So why did we go with a third-generation cephalosporin here? This is because our first-generation cephalosporins are really better for staph and strep coverage, and while our second-generation class of antibiotics does cover for some gram-negatives, our third-generation cephalosporins cover for gram-negatives a lot better. And because we know we're not dealing with an infection like Pseudomonas, there's no need to include ceftazidime, which is our third-generation cephalosporin that covers against Pseudomonas, or even our fourth-generation cephalosporin, Cefapime. And if you remember, our fifth-generation cephalosporin, ceftaroline, has similar gram-negative coverage to ceftriaxone, but it also includes coverage against MRSA, so there's no need to include this given that we're not dealing with a MRSA infection. Now, what if we change things up and said that the patient actually has ESBL-producing E. coli? In this case, we need to use something like Carbapenem because it has very reliable coverage against ESBL-producing organisms. Our penicillins and cephalosporins here would not cover against this kind of organism. Alright everyone, we hope you found this video helpful. If you did, please make sure to like and subscribe because this helps out our channel. And as always, good luck studying everyone.